The FDA and the CDC recommended pausing that vaccine 10 days ago. Western Mass News reporter Audrey Russo joins us live now with more. Audrey?
We brought your questions and concerns about this vaccine to a local doctor in anticipation of this decision today. And as you'll hear him say, he believed that it was most likely that federal investigators and officials would recommend resuming use of the vaccine with a warning to those who may be interested in getting it. But we also asked him about the future of the vaccine, as some vaccine manufacturers are already recommending booster shots within the next 12 months.
What they do in cases like this is that they'll review all the cases.
Esteban DelPilar is familiar with viruses and medicines that stop them from spreading. He's an infectious diseases physician at Baystate Medical Center. He tells Western Mass News that the CDC and FDA are likely reviewing the initial 6 reports of blood clots from women following the Johnson & Johnson vaccine and 9 additional new ones.
They will also hear from, physicians or experts in the area. In this case, it would be the hematologists, basically the blood clot experts.
He says they could recommend to continue the pause or resume its use with no disclaimers if there's enough evidence to show the single-dose COVID-19 jab and clots are not related. Otherwise, he says health officials would likely say to keep using it.
But let's put a warning on it.
With different COVID-19 variants cropping up, we asked DelPilar about booster vaccines. He says if health officials recommend certain people avoid J&J, there are studies being done to evaluate the effectiveness of getting a different manufacturer's booster.
Those studies seem to indicate that the response is really good.
If I were just to play the odds and my doctor was like, I'm not worried about clotting with you, I probably would.
Western Mass News spoke with one Northampton man about the choice of getting a vaccine that was once paused from being used. Andy Boreski, who works in mental health, believes it's a personal choice that should be made after open communication with your doctor.
I would want to talk to my doctor about any risk factors and make sure they're well informed about this issue.
Coming up on Western Mass News at 6, we're checking in with a local clinic that was prepared to give out Johnson & Johnson vaccines on the exact day that federal officials recommended pausing it. We're checking back in with them to see what trust barriers might need to be overcome in order to get the population vaccinated and how soon they're likely to resume using that shot. Live in Springfield, Audrey Russo for Western Mass News.